Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. In this segment, we're going to be speaking with Dr. Robert Cohen. He's a board-certified plastic surgeon based in Beverly Hills, and he's joining us to talk about how and when to advise patients if breast augmentation surgery is something that they should be acting on now, or maybe something that they should wait and see what the pandemic is going to do. Welcome to Health Professional Radio, Dr. Cohen.
Hi there. Thanks so much for having me today.
Board-certified plastic surgeon based in Beverly Hills. Give our listeners a bit of your professional background, and then let's talk about breast augmentation during a pandemic.
Okay. Well, I'm a board-certified plastic surgeon, as you said before. I specialize in aesthetic surgery of the breast and body. In terms of my training, I did my undergrad at Emory University, medical school at Tulane. I did my plastic surgery training at Dartmouth, and I did a aesthetic surgery fellowship in Los Angeles. And I've been in private practice for going on about 16 years. I do a lot of breast and body aesthetic surgery, and that's sort of what I've become known for. I do lectures all over the world on these topics and written multiple textbook chapters and articles. So it's something I definitely have a lot of passion in terms of research and practice.
Is breast augmentation surgery one of the main surgeries when it comes to cosmetic surgery?
Absolutely. So, breast augmentation historically has been one of the most common surgeries performed, and it has a very high satisfaction rate. And so for patients who want to enhance the size of their breast or reshape the breast or have lost volume and need to regain that, it can be a very effective tool in terms of creating aesthetic improvements, and it can be extremely satisfying and dramatic in terms of results.
Now, obviously, this pandemic has ceased a lot of elective procedures, let alone some of the procedures that healthcare providers thought were necessary, whether a pandemic was in full effect or not. Have you seen a decline in the request for plastic surgery, specifically in the breast augmentation field?
Not really. And so it's very surprising when the pandemic first hit. Obviously, we really didn't know what was going on. So out of concern for safety and trying to minimize strain on the hospitals, all the plastic surgery societies and plastic surgeons individually decided to just shut things down temporarily until we had a better idea of what's going on. And then as sort of so it was like March, April, and then as May started rolling around, we started seeing some better control over the situation. And at that point, we started to reopen for surgery cautiously because obviously aesthetic surgery rarely requires patients to be hospitalized in any fashion, so it wasn't much of a strain on the hospital system. And when it reopened, a lot of us didn't know what was going to happen. What we found was sort of the opposite of what a lot of us were thinking, which was that if anything, the demand was almost higher. For a number of reasons that are kind of theories, but I think it's partially because, patients were not spending any money on anything else and were sitting at home. So they had a little bit more maybe finances available since they weren't doing vacations and other stuff. They had a lot more free time, meaning they weren't necessarily going into work, or some of them weren't working at all. So they had that time available. And then, people were kind of spending a lot more time focusing on self-care. They were seeing themselves in the mirror more. Everybody's sort of focusing on themselves in a lot of ways. And they decided maybe this is time to do something good for themselves that they've been waiting on for maybe months or years. So oddly enough, that's sort of how things panned out for most of the plastic surgeons I've spoken with.
When you and your colleagues decided to start opening things up cautiously, as you said, based on what you were seeing, what were you telling patients who were requesting breast augmentation surgery during this pandemic?
There was a lot of extra precautions involved. So, in general, when you're dealing with aesthetic surgery, there's a lot of different safety protocols that you want to make sure are in place so that patients have the lowest risk of any complications or problems and have as safe a surgery as possible. So all of that stuff, like proper preoperative screening and labs and all those things were in place anyway. Then you have to start adding on all the additional COVID precautions. So we completely changed how the office worked. We no longer allowed significant others to come in, trying to minimize traffic in the office. Everybody got temperature checks. Everybody had to wear, in our office, we're wearing N95 masks, and all patients had to be masked as well. Prior to surgery, patients all needed to have PCR testing for COVID, and they needed to strictly quarantine before surgery, but after their COVID testing to make sure that they were COVID-free going into surgery. And they had to be extra cautious during the recovery period to try to minimize exposure. So it definitely added another whole layer of logistics and concerns, but at the same time, when all of that stuff was followed strictly, you could keep risks very, very low, and it allowed us to continue to operate, but in a tighter, more controlled fashion than even the tight controlled fashion that we did as our standard before COVID.
I would assume that you don't just accept anyone who decides that they want any type of cosmetic surgery, be it breast augmentation or anything else. Who's not a good candidate
Correct.
for breast augmentation surgery, especially during a pandemic? You mentioned many aspects of people wanting, many reasons why they would want cosmetic surgery. The mental aspect, looking at yourself in the mirror during this pandemic was one of them.
In general, with patient selection, clearly, or anyway, for an ethical surgeon, you're not going to operate on every patient that walks in the door. You need to make sure that whoever you're going to perform surgery on is physically a good candidate, mentally a good candidate, emotionally a good candidate. So from the years of experience, you very quickly can sort out who is appropriate and who isn't. And so when you say, well, who's not a good candidate for surgery, obviously if somebody has some major health issues, whether they're not safe to go under a surgical procedure, then you shouldn't be doing elective surgery on them. Most patients who come in with interest in surgery don't have any major medical problems. They usually might have some smaller issues that can be cleared by their primary care doctor or specialist. Then obviously you need to make sure the patient's goals are realistic and that what you're going to be able to achieve for them surgically is something that will actually match. And then you need to make sure that they're obviously emotionally stable for surgery. That's obviously very rarely a problem. Most people coming in are kind of understand what the surgery is about and have pretty distinct goals as far as what they want from surgery. So it's all part of the communication process. And then obviously you also have to counsel them about, well, now we're doing surgery, but it's also in a time where we're under a pandemic. So you need to take these additional precautions and make sure that you don't get COVID during particularly, going in or immediately coming out from surgery. And so that's also another layer that patients have to be aware of and take care of. But when you do all of that, the vast majority of people who are interested in having implants can have them. It's just that certain patients, for example, if they have very weak tissues, you may want to use a reinforcement material in addition to the implants, for example, to stabilize things. So there's a lot of different tools and surgical techniques that need to be tailored to each specific case for their personal anatomy, and that's part of the experience of being part of being an experienced plastic surgeon is understanding all these nuances and applying the proper techniques and choices, the proper patient, picking the best quality implants, doing everything that's possible to give as much of a safety margin as possible to each patient.
All of that being taken into consideration, what trends have you been seeing in breast augmentation requests, and have you seen an evolution in those requests based on this pandemic?
I don't know that I would say I've seen a real trend based on the pandemic per se. I would say that in general, at least with my practice, patients coming to see me, they always know that I'm going to be the top quality and top safety person they can come to. So those are always my number two things, whether it's the actual surgical technique, which implants I choose, whatever I do, I'm focusing on safety and quality as my top two important things. Now, in terms of general trends, I would say just overall, there's been a trend towards more natural results, which has always been my focus since I started my practice back in the early 2000s. But, back then, like early 2000s, we still had that era where people were going for the really big, round, fake-looking breasts. And although there's still patients who are out there that are requesting that and surgeons who are doing a lot of that kind of surgery, in general, thankfully, I think patients have been leaning much more towards a more natural, softer, better-looking result that, flatters the body and looks like, if they got lucky, that's how they were born. So that's what I tend to be seeing more and more of, are sort of maybe smaller implant requests and not really pushing for this fake look, which I'm very happy about. One thing, obviously, is patient selection, the quality of the surgeon and the surgeon making sure that they're doing everything possible to manage those issues. And one other important detail is the actual implant itself. So when we're looking at different implants, there's people kind of think of implants as like, okay, just stick an implant in, but there's a lot of variation between the different brands that are available in the U.S. In the United States, we only have 3 different brands that have been FDA approved, which is great because they're very tight about what is allowed to be placed inside a patient's body. And then for me, even beyond that, I always look at all the data and try to figure out, well, which implant specifically is going to work best for a patient. For me, I've always gravitated towards Sientra, which I think is the highest quality implant available in the U.S. Currently. And reasons being, the implant gel to softness to strength ratio is the best. So you want an implant that's going to be very strong, but still have a soft, natural feel. Because as I was saying before, implants, patients want a natural looking breast, and natural feeling is just as important. So you don't want a hard, firm implant. You want something soft but strong as well. Additionally, the way that the shell and the implant material stick together is very important. So it's that shell-gel interaction. So you don't want delaminations or things splitting apart. And then that leads, better quality there will lead to lower rupture rates. So you want implants that are going to last as long as possible. So, when I was part of a big study on 10-year data for Sientra, we found that they had some of the lowest rupture rates. And then the other thing that I love about that brand is they only sell to board-certified plastic surgeons. So if somebody's putting in one of their implants, it's somebody who has proper training. What shocks a lot of people is that literally anybody with a medical license can go out and take a weekend course, and if they're not doing surgery in a hospital, but they're doing it in some outside facility, they can start doing breast augmentation. So I hear about OB-GYNs and dermatologists and other people putting implants in, and that's a real problem because they don't have the proper training. They think it might be a very simple surgery, but it is not. It's much more complicated than people think, and there's a lot of ways it can go awry if you're not familiar with that. So when you know that you have a surgeon who's at least has the basic proper training to do it, that's very helpful. So that was another thing I always really appreciate about Sientra is that they only sell to board-certified surgeons. So I do think that some of these are really important for patients considering surgery. You have to think all the way down the board. Try to get the best quality surgeon, get the best evaluation, and then use the best products, and that's going to get you the overall best, safest result.
Give us a website where we can learn more about your practice and about Sientra as well.
Oh, sure. So my website is www.drrobertcohen.com. My Instagram is at RobertCohenMD. So between those 2 sites, and I also have a website for my Arizona practice, which is www.robertcohenmd.com. It's www.sientra.com. And so I have a ton of information on those, lots of before and afters and all of that. And it's a really good resource, I guess, for patients or doctors, for example, to look through and get sort of the latest information on breast implants and breast augmentation and all sorts of plastic surgery, not just breast surgery. And I've used all 3 manufacturers' implants, and so I have a ton of experience with them. But I tend to gravitate towards products I think are the highest quality, and that across the board, not just with implants. But for me, again, quality, safety, there should always be prioritized, number 1 and 2 most important things.
Well, I appreciate you joining us here on the program this evening. Thank you so much for your time.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.